Hi, everyone. I'm Dr. Lisa Jolly, a craniofacial orthodontist. Thank you, Kim, and the Orabiologics community for having me today. I'm going to be talking about MARPE, a method for non-surgical expansion in adults, which is a therapy that is current and becoming more available that not only widens and enhances the smile, but also function and airway health. A little bit about me. I completed dental school at UCLA, and I went on to specialize in orthodontics and dental-facial orthopedics at Temple University in Philadelphia. I then further subspecialized and did a fellowship in craniofacial orthodontics, where I was exposed to a wide range of patients, from those with congenital anomalies and craniofacial differences to complex interdisciplinary cases that I managed alongside other medical specialists. That experience really shaped how I approach care today, focusing on not just teeth, but on patients as a whole and working with an integrated team-based model of care. Alongside being part of the Tetrahealth Dental team, I also teach at the Montefiore Hospital Orthodontic Residency Program, and I serve as an orthodontist on a few craniofacial teams in Manhattan and Philadelphia. So if you're new to Tetra Health, you can see here that it is a team of biologic dental specialists that we work very closely together to make this team. We do everything from restorative to surgical to airway focused therapies. My area being craniofacial and airway focused orthodontics, I will be going deeper into MARPE as a treatment modality today. At Tetrahealth Dentistry, we have a mission statement with what we do and the way we take care of our patients. We believe in taking an integrative approach, combining the latest advances in dental medicine and scientific research, combining that with holistic treatments and biocompatible materials, elevating the health and well-being of our patients. This is what we'll be covering today. I hope you leave this webinar understanding what palatal expansion is, how MARPE works, who would be a candidate for this treatment, the key benefits of this treatment, and what you should know prior to exploring or just common questions that patients ask about this treatment. So let's talk about what expansion is. The purpose of expansion is to widen a constricted or narrow upper jaw, also known as the maxilla. When the upper jaw is too narrow, it can often cause crowding and poor alignment between the upper and lower teeth. Expansion helps create more space and can also improve nasal airflow, which optimizes and supports better breathing. So, how does expansion work? It gently separates the two halves of the upper jaw along a natural seam called the mid-palatal suture that runs along the top of your mouth. As the halves are gradually pushed apart, new bone forms in the center of the palate. This makes the change stable over time rather than just tipping the teeth outwards and expanding just the teeth. Why does this matter? So, expansion creates space needed for proper tooth alignment, and it can improve the bite, it can widen and enhance the smile, and it can also optimize breathing. So, what is the mid-palatal suture? The mid-palatal suture is a fibrous joint that connects the left and right halves of the upper jaw or maxilla. In younger patients, the suture is more flexible and it can open more easily. As we age, it gradually ossifies, which means that it becomes more rigid and interlocked, making conventional expansion less predictable. This age-related change is why we adjust our approach to expansion when we look at expanding in children, adolescents, teenagers versus adults. So in this image, you can see this is basically a diagram of what the mid-palatal suture looks like. And as we age, it becomes more interlocked and it totally fuses, as you can see at this stage. And this is basically what the image would be when looking at a 3D CBCT slice of that suture. So when looking at expansion in children, in early childhood, typically under the age of 10, is when we would start phase one or interceptive orthodontic treatment. They would usually still have some baby teeth at this time. At this stage, the suture is still open and not yet fused. So because of this, the upper jaw can be expanded relatively easily and predictably using traditional expanders, as you can see in the image above. At this stage, we're primarily achieving true skeletal expansion, meaning we're actually separating the two halves of the upper jaw, and bone responds and remodels easily. This is a video showing of what the expansion looks like. The expansion is activated, the screw is turned, it slowly widens the upper jaw, and that basically separates the two halves. And as that's separated, the bone remodels and forms in that space that's created. And then, of course, it's done in conjunction with orthodontic treatment that aligns those teeth. Around ages 11 to 12, when most of the permanent teeth have erupted, these patients typically transition or begin phase two or comprehensive orthodontic treatment. So most patients still respond to traditional expansion at this age, depending on individual growth and the amount of how much the suture has matured. At this stage, traditional expanders can often still be used in combination with full orthodontic treatment to align all the permanent teeth. Because expansion in children takes advantage of an open and responsive suture, the outcomes are both skeletal and functional. We can correct jaw width discrepancies between the upper and lower jaws, which are most commonly seen as posterior crossbites, where the top teeth tend to sit inside the bottom teeth. And that means that the upper and lower jaws are not fitting correctly. So when this happens, expansion can correct this by expanding the upper jaw and making sure that they fit well together. By expanding, we're also optimizing the environment for developing teeth. So it creates space in narrow arches for the permanent teeth to erupt into better alignment. With these jaw width discrepancies, patients often develop what we call a functional shift, where the lower jaw is forced to deviate to one side in order to basically achieve a comfortable bite. So over time, this can contribute to asymmetric growth patterns in the lower jaw or an imbalanced bite because it often has to compensate and move to one side for it to fit because the top and bottom teeth just don't fit together. So by expanding the top jaw, we eliminate this interference and we allow the lower jaw to close into a more centered and stable position. In some growing children, where the upper jaw is also positioned too far back, expansion can be combined with a face mask to help guide the upper jaw forward as the child grows. And this is basically a video that kind of shows how that would work. So an expander is used at first, and then we often combine that with the face mask. So what it does is it expands the top jaw, allow the sutures to be a little bit more mobile and promote growth as we kind of put a continuous force on the top jaw to pull it forward. Functionally, when widening the maxilla, it can also improve nasal airway dimensions. So this supports better breathing patterns, especially in children who are chronic mouth breathers or have persistent sleep apnea. Overall, in children, we're not just aligning teeth, but we're also guiding growth in a way that improves function stability and facial development. So in adolescents, typically around ages 13 to 17, teenage age, the suture is much more interlocked compared to younger children. So traditional expanders become less predictable, and the response can vary widely depending on individual skeletal maturity. So in adults, usually 18 and older, the suture is usually fully mature and highly interlocked. So at this stage, traditional tooth-borne expanders, as we had discussed with the children, are generally ineffective for true skeletal expansion. Because of these changes, we often need alternative approaches to achieve the predictable expansion in older patients, depending on what their needs are and their treatment goals. So when we deal with a more mature or fused suture, traditional expanders are no longer reliable to achieve true skeletal expansion. So instead, the forces are primarily expressed or given to the teeth, leading to dental tipping rather than actual widening of the upper jaw. So this is a video that shows what can happen. You can see that the teeth are often tipped or they're moved out of bone if not done properly. And in some cases, this unwanted stress on the supporting gums and bone can potentially push the teeth outside the safe bony envelope. And that increases the risk of periodontal side effects like gums receding and bone loss. Historically, when the suture was considered too mature or too resistant for these conventional expansion, the primary solution used to be a surgical approach known as SARPE, which is surgically assisted palatal expansion. This involved a surgical procedure, usually under general anesthesia, to help release the resistance of the suture. So cuts are made along these red lines, and then an expander is placed to widen the palate since that resistance is no longer there. So while it is effective, it is a more invasive and requires surgery to basically achieve skeletal expansion in adults. So more recently, MARPE, which stands for Miniscrew-Assisted Rapid Palatal Expansion, has changed the way we approach expansion in adolescents and adults. So instead of relying on teeth alone or requiring surgery, MARPE uses mini implants that's placed in the palate to anchor the expander directly to the bone. So this allows the forces to be more directly to the bone, enabling true skeletal expansion in many patients without need for surgical intervention. This slide summarizes the key difference between traditional expanders and MARPE. So traditional expanders, like I said, rely on teeth to deliver the force. You can see it's attached to the teeth, which works better in younger patients and becomes less predictable as patients mature. MARPE, on the other hand, uses many implants instead of teeth to direct that force for expansion, allowing the bone to fully separate and basically allows broader applications across adolescents and adults, and we're allowed to get the same amount of expansion in older patients. To better understand why this matters, it helps to distinguish between dental expansion or teeth expansion and skeletal expansion or bone expansion. So, when we do traditional or conventional expansion in patients that have mature sutures in older patients, such as teenagers or adults, this often results in tooth movement within the existing bone. So, while this can create more space and improve alignment of teeth, the amount that you can is limited by how far the teeth can safely tip before it becomes unstable. So it might cosmetically address crowding, but it does not address the underlying issue if it is caused by a narrow or constricted upper jaw. In contrast, when we do bone-based expansion with a MARPE, it actually widens the maxilla and the skeletal structure itself. So this creates real stable space supported by new bone formation, as you can see in this picture right here. And it does not allow tipping of the teeth. So because of this, skeletal expansion tends to be more stable, long term, and it can also have broader functional benefits, including improvements in airway space, tongue posture, and overall oral function beyond just correcting dental crowding. So, how MARPE works. With the help of these mini screws anchoring the expander to the roof of the mouth, it allows the force to be directed more efficiently to the upper jaw along the suture. So, as the expander is activated or turned, these forces help separate that suture, leading to an increase in the width of the upper jaw or the maxilla. So, the space between the molars increases. Usually, successful skeletal expansion results in space between the upper front teeth, as you can see over here. So this shows that the suture was successfully separated and that we're not just moving teeth. Clinically, this results in a wider upper jaw, which can help relieve dental crowding, correct skeletal crossbites, and improve nasal airflow and increasing the dimensions of the nasal cavity. So the MARPE is a gradual, controlled process. It happens slowly over weeks, allowing the body to adapt and form new bone in the space created. This results in stable, long-term skeletal change rather than just tooth movement. So, who is a candidate for MARPE? We usually determine this therapy through a comprehensive clinical evaluation, including medical history, 3D imaging to assess jaw structure, airway anatomy, and also in some cases a team-based assessment depending on how severe the symptoms are. Together, this helps us determine whether skeletal expansion is the appropriate and predictable treatment for each person. Some of the key indications and clinical features that we look for do include patients with a narrow upper jaw. These patients may have crowded or overlapping teeth. As you can see in this image above, you will also see a high arched palate. So if you were to fit about 3 fingers, roughly less than 3 fingers width would be somewhat equivalent to a narrow constricted jaw. Often these patients also show a bite where the upper teeth sit inside the lower teeth, a cross bite. A narrow upper jaw can also affect smile aesthetics, often creating dark spaces at the corners of the smile, as you can see where the arrow is pointing. So more space between the teeth and the cheek on smiling. It can also reduce tongue space, which may contribute to tongue pressure or indentations on the side of the tongue. Some patients present with breathing concerns, such as difficulty breathing through the nose, mouth breathing, snoring, or poor sleep quality. Since we are naturally meant to breathe through our nose, chronic mouth breathing often signals as an underlying issue. Other causes of this can, of course, be allergies and deviated septum, enlarged tonsils, adenoids. But one often overlooked contributor is a narrow upper jaw, which can reduce the nasal airway space, and it can also increase resistance and not allow room for appropriate tongue posture, which can further contribute to airway concerns. By widening the upper jaw palatal expansion, it can help increase nasal airway space and optimize airflow. With multifactorial airway issues, we take an interdisciplinary approach to address all the contributing factors so we can make sure that the outcomes are long-term and stable. Jaw width discrepancies, where the top and bottom jaw don't fit really well together, this can also affect how the bite comes together. So patients may experience sometimes jaw strain due to this, uneven loading of the joints, uneven forces distributed along the teeth, and it can cause a functional shift where the lower jaw moves to one side, as you can see in this video. This often results in midlines not being aligned with each other. In some cases, patients may have previously been told that surgery is the only option for expansion, so those patients would be great candidates for MARPE as well. MARPE can also be used as a non-surgical alternative to prepare for future jaw surgery. So, for patients that require jaw surgery for concerns like facial asymmetry or major jaw discrepancies where one jaw is far forward than the other, often MARPE is done first. So by widening the upper jaw first, we can create a more balanced foundation, which helps make any future surgery more predictable and stable. So now I'm going to delve into the step-by-step process of how we go about this treatment and how each phase is carefully sequenced. We first start with an appointment where we do a comprehensive clinical evaluation. We take records, we take an intraoral scan, we do a 3D CBCT imaging, and this helps us make a comprehensive assessment on the need for MARPE. We then carefully design the appliance with the lab using these records to digitally plan the position of each mini implant. And we custom make the appliance according to each patient's specific anatomy to bring about safe and effective results. The number of mini implants do range from 2 to 8, depending on the age and anatomy of the patient. So the younger patients, adolescents, teenagers, usually 2 to 4. Then the older we get, and depending on the anatomy and depending on your palatal bone and your structures, we decide if we need more to make sure that we get the results that we need. Once we fabricated the appliance, we place the appliance in office under anesthesia. So it's local anesthesia, so you're not asleep for this. You don't need to be. The placement procedure takes about 30 minutes on average, and it's fairly comfortable once you're anesthetized. Any soreness or discomfort usually only lasts for a few days and managed with over-the-counter pain medication. The patients will turn the key as per the protocol prescribed by the doctor, and you're able to do it at home and yourself. We do regular follow-ups every 2 to 4 weeks, depending on the turning protocol. And the activations phase, which is the active turning phase, usually only takes about 4 to 12 weeks on average. It does vary from patient to patient. That's usually what you would expect. Once we get successful expansion, which can be seen by space created between the two front teeth, we have achieved, and once we know we've achieved the amount of expansion that we want, we begin the phase of orthodontic treatment. And so that can be through braces or Invisalign, and that usually is done to help coordinate the top and bottom jaw, the top and bottom teeth together, and it also helps close the gap that's created. The MARPE is usually left in place for about 6 months after we're done turning. And this usually allows your body to fill bone in the space that's expanded. So it takes about 6 months for that bone to fully consolidate and basically fill in that space. So now I'd like to go into a little bit more into the key benefits of a MARPE and how it can transform your health and appearance, leading to improvements in facial aesthetics, breathing, sleep quality, and of course, TMJ and dental function as well. So by widening the upper jaw, we create a broader, fuller smile with reduced dark spaces at the corners. So we call them buccal corridors, but reduced space between the cheeks and the teeth on smiling. This added width or this widening of the upper jaw can improve overall facial balance and symmetry, bringing the proportions of the midface into better harmony. In some patients, especially those with a narrow upper jaw, this can also help enhance the midface and reduce a more sunken or constricted appearance. You can see between the two photos as well, the first being before MARPE, the second photo being after MARPE and expansion was done. You can see that more enhanced facial balance and the wider smile. Some airway benefits. By widening the upper jaw, we do increase the nasal floor, the width of the nasal floor, which in turn increases nasal volume, decreases any airway resistance, making it easier to breathe through the nose. Patients feel it pretty immediately, actually, as we start turning. Many patients notice these improvements also in breathing and sleep quality as well. In more complex cases, expansion may be part of a combined approach, sometimes alongside procedures like maxillomandibular advancement, where you bring the upper and lower jaw forward, that more definitively addresses conditions like severe obstructive sleep apnea and reduces dependency on modalities like CPAP use in patients that have severe sleep apnea. When looking at the impact on dental and TMJ function, it helps establish a more stable and balanced bite, allowing the upper and lower teeth to fit together more evenly. From a periodontal standpoint, skeletal expansion helps keep the teeth within the bone, reducing the risk of excessive tipping that can sometimes recede gums and long-term instability. It supports better TMJ health by promoting more even bite forces, balancing the loading of the joints on the right and the left, rather than placing excessive strain on one side. In growing patients, expansion, such as maybe teenagers, they can also guide a more symmetric development by eliminating the functional shifts that I talked about, allowing the jaw to close in a more centered, natural position. Depending on the patient's needs, it may be combined with adjunctive procedures or therapies to optimize outcomes for the bite, smile, and airway. So this can include minimally invasive surgical procedures to assist expansion in patients or cases that are more resistant, or patients that require jaw repositioning procedures where there are larger discrepancies in the top and bottom jaw are farther apart. And functional therapies like myofunctional therapy help support proper tongue posture and oral function. Once the expansion is achieved, it helps reestablish a more appropriate tongue posture in a wider space. The key takeaway is that MARPE is not always a standalone treatment. It can be integrated into a comprehensive plan tailored to each patient's specific skeletal and functional needs. So, here are a few key things patients should know about the expansion process. So, first, patient compliance is important. Following the activation instructions, maintaining a good oral hygiene, it all helps ensure the best and most predictable outcome. Second, every patient's anatomy is different. So that's why we use imaging and careful planning and evaluation to customize the appliance placement, the proper treatment indication, and ensure that it's appropriate for each person. Third, there is some temporary discomfort, which is normal. Patients may feel pressure or mild soreness for the first few days during the initial activation, but this typically resolves pretty quickly as they adapt to to the appliance and once we've achieved the expansion. Finally, it is common to see a small gap that develops between the front teeth during expansion. This is actually a positive sign. It's really funny. We love to see it. You'll see us as orthodontists just get so happy to see that space because it shows us that the expansion is working and that we got the expansion that we wanted. We're able to separate the suture. We got that expelled to the skeletal expansion, and that gap will be closed later during orthodontic treatment. Here are some common questions asked by patients that I would like to share. So, does the MARPE hurt? Most patients experience pressure and tightness after each activation, or mainly when you start activating or turning the screw, but it's not significant, no significant pain. Any pain that's felt within the first few days, usually within the first week or less, it's usually managed with over-the-counter pain meds, and we recommend a regimen that works pretty well. Am I too old for MARPE? MARPE is specifically designed for teenagers and adults, so age is not a disqualifier for this treatment. Will I get a gap between my teeth? And yes, as I said, that is a great sign. We love to see it. It means that the expansion is successful and it's temporary. We usually close the gap with orthodontic treatment. Sometimes we can also put some temporary bonding material if it really bothers you. So there are ways to basically camouflage that gap as we're actively turning. Will it change my face? Any changes are subtle and natural and not dramatic. We do widen the smile, usually soft tissue. The soft tissue over your face adapts and the expansion is done at a slow pace. Will I be able to eat and speak normally? Yes, definitely. May feel differently at first, but it usually takes less than a week to adjust to the appliance and you can resume a normal diet. Speech, your tongue gets used to it fairly quickly as well. How does the bottom teeth fit the top? So the bite will feel different and it will feel like it doesn't fit while expanding. But once we're done expanding and we start orthodontic treatment, which is usually done with braces or Invisalign, that helps. We'll basically, with orthodontic treatment, have the top and bottom teeth fit together into a stable bite. How is the MARPE appliance removed? Will it hurt when it's removed? Will there be holes in my mouth? No. It's typically a simpler process and it's a fairly straightforward procedure, much shorter than when we place the MARPE itself. So once the expansion and retention phase are complete, the appliance and mini screws are removed in office, usually not even requiring local anesthesia, but just topical gel is usually makes it a pretty comfortable process. It's quick, it's generally tolerated. The small areas where the mini screws are placed heal naturally over time without any long-term issues. Within less than a week, the bone and tissue fill that area. To summarize, MARPE is a non-surgical approach to widen the upper jaw that can be used both in teenagers and adults with a constricted maxilla. It works by using small mini implants to deliver controlled force directly to the palatal bone, allowing for more skeletal expansion rather than just moving teeth. The benefits go beyond creating space for teeth. It can also improve your smile. It can optimize your breathing and airway. And in some patients, it can also contribute to better sleep quality and just your overall long-term stability of your joints and your bite. Treatment is carefully planned using 3D imaging to ensure accurate diagnosis and placement. But importantly, MARPE requires specialized training and an orthodontic expertise. It cannot be viewed as a standalone procedure, and it must be performed in conjunction with comprehensive orthodontic treatment. So, with careful coordination of the bite, alignment, and finishing is required and needed to have a stable and successful outcome. To close, this approach really reflects a shift towards more integrated, comprehensive care, where we're thinking about oral health in connection with function, airway, and overall patient well-being. It also highlights how collaboration between specialties can help close gaps in care and provide more complete, consistent treatment goals for patients. I hope you're leaving today with a clear understanding of what MARPE is and what the process looks like, and whether you'd like to be evaluated if it's right for you. Thank you so much for having me. Please feel free to reach out with any questions, and I look forward to being here again. Thank you.